Hello and hi to Dr. Shan. We are students from HFP 2152 and today we will be presenting our case study on the ethical issue that occurred in Malaysia during the Covid-19 pandemic. Our presentation will focus on three major issues, which is unfair vaccine distribution, double standard in SOP enforcement, and the lack of transparency in the management of pandemic relief funds.
The main stakeholders involved include the Malaysian government, particularly the Ministry of Health and Enforcement agencies. Other stakeholders include political leaders, public figures, and elites who are perceived to have received certain privileges. Frontliners, high-risk individuals, and ordinary citizens waiting for vaccines were also heavily affected. Additionally, low-income households, small businesses, NGOs, media organizations, and international observers played a role throughout this pandemic. The first ethical issue was vaccine queue jumping, where certain influential individuals were allegedly to have received vaccines earlier than the intended priority groups. Secondly, there were clear double standards in SOP enforcement. Many ordinary citizens received large fines, while several politicians or celebrities appeared to face little or no consequences for similar violations. The third issue involved irregularities in the use of relief funds, including questionable procurement processes and significant wastage of expired vaccines worth millions of ringgit throughout this pandemic.
This issue occurred between 2020 and 2022 during the enforcement of various MCO phases and the rollout of national COVID-19 immunization program. They were reported across Malaysia with many high-profile cases occurring in Kuala Lumpur, Selangor, Sabah and multiple vaccination centres nationwide. Several factors contributed to this ethical failure. There was limited transparency in vaccine allocation and procurement decisions. Certain elites and political figures misused their position for personal benefit. Oversight during emergency fund management was weak, allowing irregularities to occur. Inconsistent enforcement guidelines also allowed inequal treatment. Together, this weakness damaged public trust and widened social inequality.
Next is how this issue happens. This issue happens because the crisis decision making was rushed and lacked proper ethical oversight. Plus, manual vaccine distribution system grids are easy to be manipulated. Next, enforcement agency applied SOP inconsistently across different groups. Lastly, procurement contracts were approved without thorough review, leading to wastage and irregularities. As a result, many citizens experienced unfair treatment and grew increasingly distrustful of public institutions.
Several solutions can prevent these issues from happening again. First, Malaysia should implement a transparent and fully digitalized vaccine allocation system with real-time tracking. Secondly, SOP enforcement must be consistent and equal for everyone, regardless of their position or status. Third, all emergency funds should undergo independent audits by MACC, PAC and external auditors. Fourth, corruption campaigns should be conducted during crises. And lastly, Malaysia should establish a permanent ethical decision-making framework for future emergencies.
The COVID-19 pandemic exposed significant weakness in fairness, transparency and accountability within Malaysia's governance system. Incidents such as queue jumping, double standards and irregular fund management clearly damage public confidence. However, with stronger transparency, equal enforcement and independent auditing, Malaysia can rebuild trust and ensure ethical integrity during future crises. Integrity is essential, not optional, for a resilient nation.